And welcome back to The Factor Uncensored. Drugs still sadly have a hold on many people and many Americans. Lisa Marie Presley recently using opioids, according to published reports, and dropped 40 to 50 pounds before her death. And Flavor Flav recently revealed he spent $2,400 a day on crack. All of this news comes after a new study revealed drug use among adults rose at the start of the pandemic in 2020. Joining me now to talk about it here on The Factor Uncensored are doctors Katrina Forte, Dashiell Guyan, and Laura Offenberger. Well, Lauren, you're not a doctor, but Laura. But welcome to The Factor Uncensored. When you guys hear about these statistics and these numbers and the number of people who are still caught by drugs, your thoughts on that?
Well, I think it's something that, although we see it really headlined in celebrity culture, it's what we're seeing every single day in our community. You know, as treatment providers and those treating patients who are suffering from substance abuse, we saw this increase in the pandemic, but then we also saw the increase in mental health. And what we've just seen is this rise of deaths, something that's been very concerning not only for our adult population, but especially for our kids.
And doctors, when you guys see a patient that may come in to see you for help, what is that like when they are struggling with that addiction and they don't see any way out? Family members have struggled to deal with the problem.
I think you have to understand the nature of addiction, and it is a disease. It's a very disabling disease. And for many people, it's not an easy fix. Some people struggle with addiction for years. And so it's a process that we have to go through with them in order to make things better for them. It's work to be done.
And Dr. Forte, how important is it that family is there to support them, to give them the backup that they need in order to get on the path to recovery?
It's intricately important because they're going to go back to most of the times those families. And it's equally as important that those families understand the nature of what the individual is dealing with so that they can help them. They can recognize signs. They can reach out for help when it's necessary.
And Laura, how do you keep family members from being frustrated? Because you know, once they go through recovery or treatment the first time, that may not be the last time. It may take a few times in order to get them on the right track.
Well, I think the first thing is we address it as frustrating. It's frustrating sometimes for treatment providers. There's many times we stay up at night. We're concerned about our patients. We're worried about our patients. We want to know what happens when they're discharging from our care. But we try to integrate the families from the very beginning. We help them to understand the disease of addiction that was brought out, to understand how it not only impacts the patient, but it impacts the entire family as well. So we have to address the treatment of the entire family as a unit to really address addiction.
Are they super disappointed when it doesn't work the first or the second time? And that's for any of you here on the panel today. When they bring that loved one in and they've spent everything they have, they put all the insurance forward that they can give, but still that person falls back off the wagon.
I think it's a disappointment for all involved, even the providers. You know, we want to see them succeed. The person wants to succeed or they wouldn't have reached out for help. Sometimes it's their last chance. You know, the family members definitely pour a lot of resources into getting their loved ones treatment. And I think that's something that needs to be addressed. I think that more funds need to be poured into treatment. So we
And Dr. Guyan, for those who are wondering, if you see a family member or loved one who may be on drugs, what should you do? Should you go to them? Should you bring a family unit together and have a meeting? How do you handle that?
All of the above. You know, when you're dealing with a drug addiction, my philosophy is I don't want to enable them, I want to empower them. Because you see, there's no magic bullet to cure drug addiction. It's one of those things that involves time, patience, effort, and energy, and the person themselves have to be committed to wanting to get off the drugs. So it's an effort by all. There's no surgical procedure that you can put them into to try to take the drug addiction out. And no pills necessarily that happen. I worked with a group of people just earlier today, and their parents are spending hundreds of dollars for them to be in an inpatient treatment program. But it involves work. It involves, everybody has to, it's a concerted effort.
All right. Doctors, Laura, thank you all for joining us here on The Factor Uncensored. We appreciate your valuable information.